Hi, and welcome to another episode of Grounded in Science. I'm Lori Lebo, the Senior Vice President of Operations for Centerstone's Institute for Clinical Excellence and Innovation. In this episode, we'll be talking with Mike Tanana, a data scientist, educational psychologist, co-founder, and Chief Technology Officer for Listen. Mike, your company has invented the only artificial intelligence training and quality improvement platform that uses gold standard evaluation tools to assess and improve fidelity to evidence-based practices. I'm telling you, the AI is a hot topic right now. It is everywhere in healthcare. It is everywhere from CNN specials to the Thursday night dramas and medical journals to Forbes magazine. It's everywhere. Talk about being in the right place at the right time, doing the right thing. How did you get here? How did you get to this place? Was this your intent from day one, or did your career kind of evolve to this place as a result of it being such a hot topic?
Well, I have always really been interested in the way that we can use technology specifically in the realm of behavioral sciences. And so I think I've had an interesting career path where I've always been a technician in some regards, but always a technician in psychology. And so I've really found that the ways that we can use statistics, the ways that we can use machine learning are really interesting in and of themselves. But I've always been someone who's been applied in the world of psychology. And I'm sort of I'm not a pure engineer who's interested in engineering in the abstract, but I've really been interested in the ways that it can solve problems in behavioral health care. My first job when I graduated from college was working with juvenile justice kids at a residential placement. And so I think that that's really informed my career, where it's, really excited about solving those problems in the real world in ways that can help people.
Yeah, that's really interesting. Was that job was that intentional? Did you seek out that type of position, or did you just kind of fall into it, and as a result, you made the connection between the data science and the educational psychology?
Funny enough, when I graduated college, I wanted to be a teacher, and no one would give me a job. And I really enjoyed the outdoors, and I got a job at this residential treatment facility for juvenile justice kids, where it was taking them outside, teaching them to rock climb, taking them on camping trips. And it was through that I started to get really excited about not just like, how do you work with one individual kid and help them, but really thinking about like broad systems, like how do you change something on average, something overall. And so I think that's what started me on the path down, getting interested in statistics, getting interested in machine learning. It was sort of a slippery slope into the world of AI after that.
Yeah, it's really interesting. It's a really unique blend of skills and talents, I think, and the perfect background for Listen for sure. So you've spent the last 15 years or so kind of working on creating platforms and helping behavioral health therapists kind of improve performance and outcomes. In your experience and what you know of the world today and all of the things happening in AI and especially in mental health care, what are some of the things, what are the big things right now that are exciting in AI and behavioral or mental health care?
I think the thing that's really changed in the last 3 to 5 years is that, 5 years ago, 10 years ago, I think the exciting things in behavioral health were all in the worlds of statistics and numbers, right? Where it was really interesting that we could use computers to predict things about outcomes, to understand about who are going to benefit from services, right? And I that was really exciting to me. what's been exciting in the last 5 years, last 3 to 5 years, is that we've started to understand something about language, right? That I think we've hit a turning point where technology is at a point where we can take large sets of unstructured language and say something really interesting, right? That we can take a 50-minute session, right? Psychotherapy session, which includes something like 10 to 20,000 individual words in it. And we can take that and we can say something about how empathic the therapist was in a very reliable way. We can say how many open questions they asked and be really, really accurate about that, right? We can say something about the sentiment of the client. Were they really sad? Were they really happy? Did it change over the course of that session, right? And that's not something that we could do particularly well 10 years ago. But now we can do it about as well as a human being, or sometimes better.
That's amazing.
Right? And it's kind of mind-blowing that there are problems that 10 years ago I thought we'd do well at, but we'd never solve, right? A good example is rating the CTRS. The CTRS is cognitive therapy rating scale. It's basically a gold standard measure of how well someone did CBT, right? But there are all these 0 to 7 scales for an entire session. And it used to be this really hard problem. There were these very subtle, complicated constructs, right? And I didn't think that we would ever do that perfect. I think we do about 80% as well as humans, 75% as well as humans. On most things now, we can basically replicate expert human judgment. And I just didn't think that those were things that we were going to solve, right? And so now what's amazing to me is that the problems that we're attacking now have gone beyond that. We've sort of leapfrogged the things that I thought were going to be the hard, interesting problems and gone into things that are more subtle. It's like, how well can we write a clinical note? That's sort of the hard and interesting problem. And 10 years ago, that just wasn't in the world of things that I thought that we would ever be attacking in my lifetime.
Well, it is amazing to think. I mean, I could remember 30 years ago when a smartphone seemed so out of this world.
Right?
No way that'll ever work. We'll have paper maps and have to pull over at gas stations to ask directions forever. I never would have even considered something like the smartphones that we have now. So it is exciting to see how things evolve. In terms of AI, I think we're as a group, especially in healthcare, we're familiar with robot-assisted surgeries and robots that can read radiology reports or provide radiology reports. Mental health seems so much more personal. We're so accepting of robots and AI in some areas of healthcare. And in others, I think it makes us really nervous. And for mental health care, knowing the just deeply personal by nature of the work, one of the concerns and things that we hear in Centerstone and from friends and family and just in the community in general is, how do we know that AI is safe in mental health care? How do I know that my session isn't going to be broadcast and out there for anyone who has access to the internet?
I think that we're at a point right now where I think even people like me who have been just really in this field for a long time are surprised by the things that we can do all of a sudden, right? The things that we're starting to get good at. And I think that the ethical frameworks are still catching up, right? The FDA has had really good frameworks around what kind of information you need for specific kinds of drugs, right? They have really, really good frameworks around what information you report, what kinds of experiments do you need to do before you can release something to the public, what kinds of warning labels, and how big, what size, what color a warning label should be when a drug has a dangerous side effect, right?
Mhm.
A colleague, a psychiatrist, pointed out to me recently that we are actually shockingly okay with giving people drugs that we know will cause or increase the risk of suicide. You
Mm.
forget that, right? That certain drugs actually have very dangerous side effects.
Sure. Yeah.
We have frameworks, right, for using those drugs where we have to report that to patients and be really clear about it. The drug has to have so many other benefits, right, that it's okay to put that out in the world, right? You have to be under the supervision of someone who understands those risks and can explain them to you, right? And so we have these frameworks for drugs, where we as a society sort of understand how to handle those things. And we don't have those same safeguards for artificial intelligence. And they're going to need to catch up, right? We're going to need to have formal regulation. We're going to have formal reporting around artificial intelligence. And in the interim right now, people who are using it just need to know that there are dangerous things out there. There are people who are using untested products. And so, in the absence of something like an FDA framework for the safe use of these things, people have to be their own smart consumers. The agencies that are using AI should be asking about what studies that people have done, what safeguards are in place. They should be asking, when do these AI systems go wrong? And if a company says never, they shouldn't believe them. Because, right, if you ask a drug company, when is your drug, what are the adverse side effects of the drug, and they say none, you would say, no, I don't believe you. I want to know
Right.
what, right? There should be the same response to a company that's selling AI, right? That there has to be this transparency, and there has to be this realization that there are going to be side effects. And we
Yeah.
just know that they are, that people have to have done the research to figure out when things work well and when they don't, and to just be really upfront and transparent, both between a company and an agency, between an agency and individual clients that might come in contact with that data. Right?
Right. That's a great analogy. That's a great analogy. What do you say? Centerstone is on the cusp of implementing several different types of AI platforms to improve our performance and care outcomes. What should we be saying to both our therapists, our caregivers, our providers? What should we tell them to? What should they be asking us? And what should we be saying to our clients?
So I think first, when it comes to therapists, I think therapists are concerned that they're going to be unfairly evaluated, right? And I think I think the first thing to say to therapists is that we're not using these tools to hire and fire people. We're using these tools to improve, right? That these tools are for everybody to get better. And so you really have to have some degree of trust with your clinicians already, right? That you really want them to get better at their jobs, and the clinicians have to believe that you're going to do that in a good faith way, right?
Right.
And so there has to be some amount of trust building there. But then, I think starting with something like a training product is sort of a really nice way to build that trust with AI. And we've seen that with a lot of other customers where when you use the training product and you can see that feedback on such a small segment of something you've done, just 2 or 3 sentences that you're practicing saying, that's a really nice way to build that trust, right? Where they can see over and over again, like, here's a good response, here's a bad response.
Right.
It sort of is a good way of building that trust between the therapist, the provider, and this AI system, right? And so that when you start to scale it to larger interactions, right, a 15-minute clinical encounter, that they've already sort of built a little bit of that trust, right? And they're also used to that idea of like trying to get better. I think we all want to be good at what we're doing. We just want it to be a fair judgment, right? We want it to be the opportunity to improve in what we're doing in a safe place, right? Where there's some amount of trust that we're allowed to fail. But everybody is on board with the idea of we want to get better at jobs. And I think that the places where implementation is successful, AI implementation or non-AI implementation, it's that idea of trust, and that shared common goal of everybody being better at what they do.
What do you recommend that a company say to their clients if you are introducing AI? How do you introduce that to your clients in a way that they are not running for the hills because they're concerned their most deepest, darkest private thoughts are going to be out there?
So I think that is a really important question, that when a client is coming in contact with AI, first of all, there needs to be just an assessment of the risks, right? A training product where a therapist is interacting with the training platform, there's never any client data interacting with it. That's kind of in a different category where it's sort of isolated. You don't really need to tell clients about that necessarily. Maybe there needs to be some broad transparency around how you do training. But once you're talking about AI analyzing a conversation that a client is involved in, I think you need to explain what the purpose is, right? How is that information being used, right? Is it helping the clinician generate their clinical notes, a draft of their clinical note? Is it to improve the performance of the clinician? I think these are all things that individuals are okay with, as long as they're part of that consent process, right? That you just kind of want there to be transparency around what you're doing. We've been recording sensitive phone calls in this country for decades, and people are kind of okay with it, where it's like just a real brief explanation of like, hey, we record this call because we want the people at our call center to be better at their jobs. People are like, yeah, I'd like that too, right? And as someone who's been recording psychotherapy interactions and using them in both research and product development over years, what I think is that clients are on board with it, but they first have to be given a choice, and second, you just have to tell them like what it's being used for and what it's not going to be used for, right? I think giving people control over their information is really important. And back to my earlier point, I think eventually there are going to be mandates around that, right? That I think that governments are going to have to figure out how exactly people give permission for their healthcare data to be used for certain things. And people are going to be okay with it. Just they have to be given a choice, right? And there has to be some sense of exactly how it's going to be used and how it's not going to be used, right?
Those are all really good points. And it makes me think about when we think about privacy and compliance with HIPAA. I'm also at the same time thinking about the very limited knowledge that I have of machine learning and AI. And my understanding, and correct me if I'm wrong here, that there are algorithms within programs that are learning data sets. And the more data that is in the data set, the better learning is taking place. Yeah. Right? So there is a desire for more data, so that we can learn more. And does that desire for more data put clients and their private health information at risk? That's one part of my question. And the other is, if our data that we're feeding, so to speak, this AI platform is coming from a defined group of people, does that bias the data in any way toward that group? So let's say we have clients who are in underserved populations, or the whole conversation of diversity and data equity comes to mind. How does AI address those kinds of ethical or data equity concerns? Or can it address those?
That's, those are both excellent questions. So let me start with the first question. So in terms of the risks from that data being used in training, there are definitely risks, right? And we have to really think differently about healthcare data than maybe we thought about, some of the other, sort of unstructured data that just gets grabbed from the internet that they use for training things like large language models, right? With healthcare data, um, you have to treat it really differently, right? That you can't just sort of throw it all together with publicly available data sets to go into large model training, right? That when we use healthcare data to train models, it's always in a very walled off way, right? That you sort of have a model um, that's being trained on a specific data set for a specific purpose. And the whole time you're monitoring it, right? It's really easy for models to accidentally learn personal data and then spit it back out if you're not careful. And so you have to be really careful about when the data is going in to the model. That first you're excluding things that are would be really egregious examples of learning PHI, specific people's names, right? Specific addresses, right? Models now can learn that. They can memorize that information and it can accidentally come out the other side. So you have to be careful on that one side of what goes in and what does it look like before it goes in. When we train models to learn clinical notes, we human beings go through and manually de-identify them before it goes into the model, right? So there's a check on that, right? And then when things come out, you have to treat that model differently than you would these free models that are floating around the internet, right? That model has to be kept in a secure location because of the potential for releasing certain kinds of information. If you have to check the model results and what it's producing, and you need to get feedback from your end users on what it's doing and the performance of that model, right? For any model, there should be some quantitative measure of how it's doing, where you should be both making sure that your model is doing what it's intended to do, um, having some quantitative measure of how good that is, and releasing that information to customers. So that's all that first question. On the second question, when you think about bias, when you learn on specific data sets, is there the potential for bias? Absolutely. And it almost certainly will happen the more narrow that training data becomes, right? And so there's, some important things you can do. One is just making sure that your training data is as diverse as you can get, that comes from lots of different places with lots of different groups who have lots of different kinds of accents, and you make some effort to quantify that information that's going in, right? And second, on sort of the outputs, when you're quantitatively evaluating how well you're doing, with any tool, there's a potential for bias. Is it a human being that's making a judgment? That tool has a potential for bias. Our old school pen and paper actuarial assessments, from back in the 90s and 2000s, those tools have lots of potential for bias. And of course, an AI tool has the potential for bias. But there are methods that we have for measuring the bias in these different tools. And these methods aren't new. That tools like the SAT have been asking the question of what is the bias of our tool, right? And we can apply those same methods to AI. And so for our platform, every year we release a bias report, which actually compares how we do with a majority ethnicity population to a racial ethnic minority population, asking whether the model performance is the same or different in those two different groups. And if it's different, what adjustments can you make to ensure that you're sort of fairly assessing both groups, right? But back to my earlier point is that, like, we should be doing this with all sorts of different processes, right? Even if it's a pen and paper process, right? All of these have the potential for bias.
Right, right. I think back to way back when I was in school and learning about epidemiology and population health, and we studied Framingham data and the Nurses Health Study and the Harvard Men's Study.
Right.
Obvious bias in a lot of those groups, yet we just accepted it, and we made national health recommendations based on that data. Do you think that AI and the tools that we have now are an improvement over that? We can learn things much faster than those decade-long studies of of once upon a time. But is the output better or less biased, or have we improved only in speed and not necessarily in accuracy?
I think that we've improved in terms of there's a new breadth of tasks that we can do, right, with these AI models, things that are more subtle, things that are more nuanced, that we can respond in natural language to a prompt. It really opens up this whole new world in terms of the things that we're able to do and the levels of performance that we can achieve those things at. But I think the potential for bias is actually higher in some ways, that we can encode human biases in more subtle and complicated ways.
Yes. Yeah.
Right. Than older tools, right? When you think about a statistical tool from circa the 2000s, there's only so many ways you could encode bias, and you could actually delineate all of those different ways, right? And a lot of times people didn't do it, is the sad thing. But there are the potential for bias here. There's the same potential, but there's so many ways that it can play out when you're using natural language as an output, right? And so you have to get creative in terms of trying to elicit those biases, trying to measure those biases, right? And bias is a complicated thing. It's not just one thing, right? It plays itself out in a lot of different subtle ways, and so it's not something where we're ever going to be finished, right? Where I come from, the juvenile justice world, they've been measuring bias for decades and doing a good job at measuring bias, not solving it necessarily, but measuring.
Right, recognizing that it's there.
Right, and they measure bias in juvenile justice at so many different decision points, but solving it is a lifelong task. And so I think that that's going to be something that's going to be never finished, but something that we have to be vigilant about with AI models.
It's also interesting. There are so many things, but it's such a great conversation. And there's a million more things that I could ask about. You mentioned earlier about regulatory pieces and who's keeping an eye on this, who's watching all this, who's in charge here of these things that are being created. And it sounds like there's not anything formal in place yet. Where do you think that should come from?
I think that the federal government is just going to, whether or not I think they should, and I think that they should, they are in fact eventually, is it going to be in 3 years or 20 years? I'm not sure. Eventually, they're going to create a regulatory framework for AI that will have to evolve over time. But I think that that's a good thing, because I think right now, the world that we're in, people are just kind of throwing all sorts of different problems at these AI tools, and it seems like they do okay at them, but nobody is sort of measuring how well they do. In what situations do they do poorly, and nobody's reporting that information to customers or the end users. And I think that from my perspective, it's dangerous. And once you talk about healthcare and behavioral healthcare, it can impact people's lives. And so I think that there will be regulatory guidelines. And in the interim, I think the job of responsible companies is to voluntarily submit to those things that are ethical and responsible ways of using AI.
Right. That's what I was going to ask. In the absence of a more global, universal oversight, it sounds like Listen is doing some things internally to keep an eye on what's happening. And are we learning too much too fast? And can we pull in the reins when needed? And I think the same is probably true for companies like and healthcare providers like Centerstone to have our own policies in place. How are we going to manage this? At what point do we say, oh, we need to take a look at that? Putting some checks and balances in place to make sure that we are doing the best thing for our clients, and so that we can assure them that we have some processes in place. Last question. Let's end on a good note. What is the very best, most exciting thing that AI can do in mental health care?
So I think the thing that's really exciting to me is that mental health care for the last 100 years has essentially been something that's happened in a room with a closed door. And as mental health has become more accessible to more people, the problem has only gotten worse because it's bigger, right? So many people are doing so many different things, and there's no real way to measure quality. The same way that you could, for example, with a doctor, you could ask how many times have they prescribed a certain drug, how many times have they done a certain kind of test. There's not something similar in behavioral health care. And I think what's exciting to me is both that we're going to start to get a sense of what the general quality is of behavioral health care and why, right? It's not only that we're going to be able to really start to understand who is doing sort of the best therapy out there, and being able to find them and say, like, this person is really creating great outcomes, but it's also understanding what the specific behaviors that they're doing are really influencing outcomes, not just sort of at a broad sense of like, is it CBT, is it motivational interviewing, but really at a fine-grained level where you can pick out those individual talk turns that they're making, that are really influencing change. And I think it's just a really exciting time. It's exciting for me as someone who likes to be able to measure things and see what's happening. It's also exciting if you're a clinician, to really start to understand the things that you're doing that are eliciting change, and to be able to do more of them, right? To be able to have like a gauge that's almost like a fuel gauge on your car that's sort of helping you understand how you can do better, what things that you're doing are really moving the needle on patient outcomes.
Yeah, I think thinking about how we communicate and message AI to both our providers as well as our consumers of behavioral health care, what you just described is the selling point. I mean, that's, as a consumer of behavioral health care, I think, wow, if my organization, this organization that I'm working with, is learning these things and engaging in this, what if that means that it only takes me 5 years versus 20 years to have a breakthrough? Or that was a long-term example myself. Use my own. I just think if what if we could learn faster and learn those nuanced things, those pieces that will make the biggest impact and help people feel better faster. And it's just, I think that's how you sell it to anybody.
Exactly.
Whatever risks are involved, yes, we see those, we recognize those, and we're doing these things to help to protect both our therapists and our clients. But this is the potential. This is the exciting outcome that we're in search of. So very exciting. And again, I would could talk with you about this topic all afternoon. Thank you so much for taking time today to meet with me. Such a pleasure having you, and I know that our audience will also really appreciate hearing all these the concerns that are coming up and learning more about those kinds of things. So thank you, Mike.
Thanks so much, Lori. It's really, really great to talk with you today.